guys, Dr. Anthony here. Today we're looking at thyroid disease. I want to look at it from the perspective of chronic. Thyroid disease, hypothyroidism, even Hashimoto's, is a chronic condition. It seems to be around for a while and it seems to develop over a long period of time. And the standard of care is, okay, so you've got these conditions, these treatments that we're going to give you are going to be management treatments. Every month you're going to come back and you're going to get a repeat of your script onward and ad infinitum. That's fine if you're comfortable with that and you're happy to go. Maybe you're in that rut of it's normal to go and do that. Well, it's not normal for your body. Your body is a self-regulating organism and it's designed to heal. Given the right circumstances, the right influences, the right food, the right circumstances, environment, your body has got the power to heal. And that's what I want to try and share with you and move the way you think, move it out from the typical medical model into the space of holistic healing, giving your body the ability to move from what they call the germ theory to the terrain theory. That's what's going to move your body into healing. So let's explore this a little bit now. Right, so which treatment approach do you use? Maybe, and this is the majority of people are stuck on the medical model and they're doing that thing every month. But have you realized that this regular medical treatment is based on repetition and on management? You're not curing. Did you get it? And maybe you get that because that's what they tell you. I'm telling you, there's a space and an opportunity to heal your thyroid disease. Right. Patients, they too often lose hope. They don't have a vision. You need to have a vision of your health. Where are you going? It's not the same thing every day, every month, every year. You've got to move out of that space. And I'm going to show you how to get there. Right. You've got to ask the question, why? Why have you got thyroid disease? What vision, what plan have you got to restore yourself to health? And how are you going to get there? Who's going to help you to get there? Because most of the time, this being a chronic illness, chronic problem, you can't do it by yourself. Let's look at thyroid gland disease and assessment of thyroid hyperfunction or thyroid dysfunction. Now, the gold standard, it seems, is testing your thyroid hormones. And the typical tests that they use are, number one, they're up to 50% of the time they are incorrect. What does that mean? If we take your blood to one lab and get it tested, and then we go to another lab and get it tested, it can be up to 50% of the time a significant difference in those same results. That's number one. Number two, what about incorrect interpretation of those labs? So what happens is the reference ranges are too wide, so you get the typical thing where the doctor says, oh, yes, your labs are fine, you're not hypothyroid anymore, or yes, they're within range. That is not accurate. That doesn't give and inspire confidence here. Remember, you've got to combine the clinical symptoms. Hey, how are you feeling? I've got energy today. I'm confident today. My constipation is gone. You've got to have the clinical, and then you can mesh that with the testing, right? Also, the type of tests that are done, the traditional type of tests that are done most of the time, they're going to do a TSH, a thyroid stimulating hormone, and a T4. There's no way they can tell you what is going on with your thyroid with those two tests. You have to include the other basics, free T3, free T4, and the antibody test as well, to get a basis of what is going on with your thyroid, right? So often a lot of these labs are not going to be paid for by your medical insurance. You must know that, and you must get over that, because we're looking for the answers. The answers are going to lead us to the cure. There's other ways that you can also look, and I like to combine it. You know, there's many ways to skin a cat. So let's use that as a combo. You can use your labs from your medical doctor, but Broder Barnes also used the basal temperature charting way of looking at it, where you use your metabolic rate, your temperature, to determine are you hypothyroid or not. Also, we look at hair tissue mineral analysis. That uses the ratio of calcium to potassium, and depending on what that rate and what that level is, you can see straight away your thyroid is not working. And here's the crunch, here's the crux of it. So you do your labs, and the labs are okay, they're within range, they're good, so to speak. But if you do that hair tissue mineral analysis and your calcium potassium ratio is wrong, I can guarantee you your thyroid is not working properly. The hormones might be right, but is that hormone getting to the receptor site and having the effect on the cells that it should have? I don't think that's always the case. Let's go further. Let's look at holistic medicine. Let's look at holism and see what we can do. I want to change your mindset. Let's move from the germ theory, and we trade it in for the terrain theory. It's not about the germ, it's how strong your terrain is. How strong is your body, your immune system, able to stand up against that pathogen, or not sleeping, or maybe a deficiency in what you're eating. All right? We're looking at the vital force. That's the reserves that your body has. That's all important. The reserves your body has, and then we're looking to heal. Remember, it's not management, it's healing. Here's a question. Have you ever thought, what is it that you want to achieve with your thyroid and your health? That's going to take many people some time to think and get an answer out. But if you can get an answer out there, you're so far forward and on your way to healing. You see, it's all about looking at the causative factors, and we're going to focus on thyroid. But remember, it's holism. It's not just about the thyroid. Let's say I say to you, listen, let's go on a picnic. Come with me. And I take your hand and we start walking off. It's not only your hand that comes with, it's your whole body that comes with. So we're looking at the whole body. Yes, we might focus and concentrate on thyroid things, but it's your whole body. We're going to be looking at the adrenals. We're going to be looking at the thyroid. We're going to be looking at how your digestion is working. These all play a super important part in your endocrine system and the thyroid. So looking at that, and we're going to look and focus on some causative factors. That is things like mineral deficiencies. We've got to address that. Metal toxicities, that being heavy metals. Halogen toxicities such as the bromine or the fluorine. Those are all things in our environment that are just so prevalent today and can downregulate our thyroid. Then what about the emotional blocks? That's a biggie. I actually call that the main causative factor. So when we start treatment, you're going to look at the minor causative factors, and these minor causative factors are things that people are familiar with. If I tell you you've got a magnesium deficiency, normally straight away you're like, all right, great, I'm going to eat foods that have got more magnesium, or I'm going to take a supplement that has more magnesium. Right? Makes sense? Absolutely. But we're not just looking at the deficiencies. The emotional factors can play have a much bigger impact on your body not healing. Remember, we spoke about these reserves that your body has to heal. Emotional trauma can limit that hugely by upregulating the stress hormones. So I want you to know, it's not about just popping a pill, even if that pill is a natural pill. Can you imagine that? Because we've been so designed to move that way. And what's the pill? What's the treatment? What's the deficiency? It's not about that. It's about taking that vital force, using your environment, the environmental factors, or can I say the lifestyle factors, changing that. You know, they say all work and no play makes Jack a dull boy. You've got to have balance. You've got to have rest. You've got to have work. You've got to have play. All of these things. You've got to have sleep. Very, very important. And when you sleep, you've got to go into that deep REM sleep to regenerate your adrenals. So let's take a quick look at what does holistic health help your body with. You are aware. It helps you to respond to your environment. Okay, I need to get enough sunlight so I can get enough vitamin D to help to rebalance my hormones. Your autonomic nervous system is also rebalanced and regenerated, so it's able to respond and react to all the influences and stimuli in your life, in your daily life and daily goings on. And so what we're doing, we're restoring that regenerative sleep, which with that regenerative sleep you get a process of autophagy, where your body's able to regenerate and heal. All of these things are important. And what happens today in our rush, instant gratification world is we don't take that so importantly. That can wait. That's in the background. I've got to do this. I've got to do that. And yes, it's true. Now and then it's fine. But what we're seeing happening is the imbalance is happening more and more. And when that goes on for a long period of time, what we find is then you get the chronic disease process. Then oh yes, my thyroid's out. I'm so tired. Why am I so tired? Why am I putting on the weight? And all the symptoms come on. And then actually the stats say that it takes about 5 to 10 years to get a proper diagnosis of Hashimoto's disease. So for those 5 to 10 years, you're just going around in circles. You're not being able to heal. That's 5 to 10 years of, besides not having optimum vitality and health, you are depressed, you're down. You don't have to have it that way. Get into yourself. Get focused on what you can do. Get independent with your health. So if I have to consider remedies from a homeopathic perspective that I'm going to use for thyroid issues, let me say 99% of the time it's an individual affair. If your friend or your family member has got a thyroid dysfunction and they took remedy A, that doesn't necessarily mean that you're going to take remedy A. Don't forget that. And it's so easy to fold in that sense. Oh, it worked for them, let me try it. This is not modern medicine where each remedy or each drug is indicated for a specific indication. Homeopathic remedies work on the individual and what the symptom and the process that the individual is manifesting and experiencing. So if we're looking at Hashimoto's, you can look at a remedy called carcinosin. It's very good for autoimmunity, and with the autoimmune thyroiditis, it helps from a miasmic perspective. It gives miasmic support, right? If we talk about emotions, and we've spoken a little bit previously about it, we need to get that emotional trauma from our bodies and remove it. That emotional trauma holds us down. It impedes us. It allows us not to shine and to become vibrant. Well, I'm depressed, or since that passing of a family member, I just can't get my stuff together. It holds us down. Homeopathic remedies work tremendously well to eliminate that. And there you could look at remedies like Natmur, Ignatia. Staphysagra is also amazing. That's more where there is a suppressed anger from whatever the emotional pressure was from. We also spoke of toxicities in this world where there's thyroid conditions such as toxicities with heavy metals, or we've got the halogen toxicities such as bromine or fluoride. That's why we look at remedies like brominum or iodine or nux or merc. Those all help, go a long way to assist the body's detox pathways to eliminate those elements. Then you've got what I would call maybe the regular remedies. This maybe you'd be able to prescribe symptomatically, the lycopodium, sepias, graphites, or the thyroidinum. But if you're not sure, get in touch with your homeopath and they can really help you with this. Further to this, can you remember we spoke about the emotions, and I said the emotions is the major player, the major causative factor? Okay, now we must use this. You need to change your paradigm. These subconscious habits that have been programmed into your body, into your way of acting, your way of feeling, and your way of responding from most of the time from your youth all the way up. You need to change it. There's 2 ways that you can change it. Some emotional impact that gets you to change it. I use the analogy where I say the pain of having this problem is worse than the pain of changing your reality to get out of this problem. That's what's going to move you forward. The other one that's going to move you forward is maybe a slow, steady progression of you changing your daily habits. This is where homeopathy and natural medicine works amazingly to slowly inch you forward. Those remedies work on the emotional sphere, on the emotional level, calming you down, putting a peace inside you, helping your thyroid to reboot itself. So what am I saying? Let's wrap it up. Get your hands dirty. Try things outside your comfort zone. We've all been pushed into this mold of we can't do it, we need expert help, and that's the only way we're going to get better. No, you're the master of your reality. Open yourself up to these new opportunities. You're responsible and in charge of your health. Try that. It might be daunting in the beginning. Try that slowly with small little things. Listen, what is your body needing? Go for it. You'll see things will start to change. In the beginning, it might be a bit scary. Ooh, I've never done this before. How am I going to do this? Phone a friend up. Check something out on the internet. Make slow but big baby steps forward. So last but not least, and this might be a bit of a stretch for your imagination, and if it is, don't worry about it. When you hear other stuff that aligns with it, it'll start to make sense and start moving forward and attracting you. So let me ask you the question then. So what is your purpose? What are you doing here? Are you in a dead-end job or a dead-end relationship or in a dead-end ... What is that? Change it slowly but surely. You've got to align with your purpose. You know, if I give you the analogy of, well, you're stressed. When you're stressed, your hormones get out of sync, and then your emotions as well. And that happens when you're not happy. So move that around, change that, and you'll see your endocrine system will stand up to be counted back into homeostasis. Last thing to say, wrapping it up here, start by determining what system of medicine works for you. Medicine or the medical model is fine. If that's what you're comfortable with, start there. You can always change over at a later date when you've started to question a lot of things, and if maybe it's not working for you, move over to the holism model. Have a look and see what are your goals with your healthcare and your improvement. So often we just outsource it. Oh, the doctor will tell me everything. No. What is it that you want? Okay, I want my hair to grow back in the next year. I want to lose 10 kilograms. I want to be happy with this. And that might mean you have to ensure that you sleep more, or that you're going to be eating a different diet, or whatever it is. Make a plan. Just start. It probably won't be perfect to start off with, but it's better than what it was before. Maybe you need a lifestyle change. Go for it. Start again. And if you don't succeed at first, just keep trying. Keep going forward. You can't fail that way. Just improvement. Even if improvement is little bit by little bit. But you'll get there.